pleasant good evening. You are listening to the program The Voice of Pilgrim, emanating from Pilgrim Baptist Temple St. James Road, where our senior pastor is Reverend Dr. Leroy Nathaniel Major. We are known as the Church with the Open Doors, hence our hearts are also open to you. For more information on this radio broadcast, you may contact our church at 393-3644. Sponsors for this broadcast are Jonah Telecom Bahamas Limited at 376-8999, Easy Trucking at 357-4394, The Craft Shack at 829-7412, ATC Financial Advisors and Consultants at 376-0411, and also the fine members of the Pilgrim Baptist Temple.
Good evening, and welcome to the Voice of Pilgrim. I'm your host, Minister Kevin Curtis. My co-host, Brother Travis Hall, will not be in this evening, but to see the show is promising to be an exciting one. The Bible declares that in the beginning was the Word. So let's begin. Our scripture text is 3 John 1 and 2, which reads, Beloved, I wish above all things that thou mayest prosper and be in good health, even as thy soul prospereth. Tonight, our topic is Covid-19 vaccine, where our guest is Ms. Sienna Evans.
Thank you for having me.
Thank you for being here on the show this evening. Before we start, can you tell us a little about yourself?
Yeah, sure. My name is Sienna, like you just said. I'm the owner of Access Medical Laboratory. Originally, we actually opened very recently due to the COVID-19 pandemic. My field is in cellular neuroscience and microbiology, so I have an extensive background in research and lab and everything. So when COVID came about, we really saw the need for additional testing. At the time, I don't know if you guys remember the reference laboratory and Doctors Hospital, they were swamped because they were trying to get so many COVID tests. That was a really big thing. So we opened our lab and got all of our equipment in order to run COVID tests. And in addition to that, it's always been my dream to conduct research here in the Bahamas. I really feel like we need more people, young people and young women, especially in STEM, which is science, technology, engineering, and math. Okay. So I feel like I'm kind of rambling on now, but yeah, that's my background. That's why I'm here. Wow. So just ask any question you want.
Well, good to have you here. Before we start about our COVID-19 vaccine, can you, neurosurgeon, what all does that entail or deals with?
Well, neuroscience is basically the science of the brain. Okay. My expertise is looking at oxidative stress and as it relates to Alzheimer's. So I look at, basically how your cells in your brain age, essentially, and how to sort of slow down that process in order to help slow down Alzheimer's and other neurodegenerative diseases. That's really what I did my coursework on in university, and that's what I'm really most passionate about. But when you look at cells, the equipment is all basically the same. So when you're looking at COVID and coronavirus viruses and everything, you kind of get a similar education on how to go about looking at all of those things. So the process is over just fine.
Where's your lab located?
So Access Medical Lab is on East Bay Street. It's across from Rubis gas station.
Oh, that's what you guys are. Yeah, okay. Yeah. Wow, this stuff. So you know where it is.
Now you know.
Okay, so now as we go into talking about the vaccine, we all know as a child in school, we take the vaccination when it comes to in school, we take vaccination, whether it be for the measles, the mumps, or even chickenpox.
Right.
Is the COVID-19 vaccine the same?
Well, it's the same concept. The purpose of a vaccine is to introduce a sort of a less deadly, inactive form of the virus into your body so that your immune system can sort of learn how to fight it off. Okay. But And so that is the, basically the thing with all of those measles, mumps, chickenpox, and they're trying to do the same thing with COVID. Now, the biggest thing with COVID is that because this pandemic kind of hit the world so fast, and it's something that, we weren't necessarily prepared for, the vaccine was developed very quickly. So you have different pharmaceutical companies so essentially scrambling to get a vaccine that works, most effectively and is least harmful to your body. So that I think has been, the biggest problem that you see now with the COVID vaccine. But yeah, to answer your question, it's the same type of concept as those other vaccinations that you mentioned.
Okay. Well, we know now in the Bahamas we're taking I'll get the word properly, the AstraZeneca vaccine.
Yeah.
Okay, and we heard that it may cause some blood clots. How safe is it?
Well, the thing about it is it's going to, each individual person is different, and everybody's body reacts differently. So AstraZeneca is a vaccine that was approved by the CDC and the FDA, which is the Food and Drug Administration and Center for Disease Control. And so typically when they roll out a vaccination, it's generally safe.
Okay.
However, there may be a few side effects that, this is all a process of a new vaccination that has to be ironed out. It's not absolutely perfect. So I would say generally, if you're a person of, good health or, you're not prone to having blood clots or anything like that, I would say it's perfectly fine to take. Yeah.
So there will be some side effects of taking the vaccine.
Well, yeah, I mean, people say the first day, they had a little bit of fatigue because it's essentially introducing an inactive form of a virus to your body. So your body is going to go through the motions of essentially fighting it off, but that's in order to build up your immune system. It's not, you're not going to have the same symptoms of the virus, obviously, but your body's going to go through that process in order to build up its own immunity and your immune system. So that it may potentially protect you better from COVID-19 if you were to be exposed to it in the future. So.
Okay, all right, that's good. Does the vaccine prevent you from getting COVID?
Well, there's been a lot of talk about that. Yes, the purpose of the vaccine is to prevent the spread of COVID. However, like I mentioned, because it's a new vaccine, it's not 100%, nothing is 100% effective. So there are going to be some cases where, someone got vaccinated and they ended up getting the virus, but it's all just because everyone's immune system is different, everybody is different, everyone reacts to things differently. So you're going to have those 1 or 2 or 3 cases where people do end up getting the virus, but that is the exception. I wouldn't say that is, the rule.
Okay.
So I wouldn't be concerned about it.
Well, we know some people are reluctant to get the shot. And everybody is entitled to their own opinion. But
Right.
Why do you think some people are reluctant to get it?
I mean, like I said, it's something that's new. I think it's not just the fact that the vaccination itself is new, but I don't think people really like to be told what to do.
Yeah.
Especially with their health and with their body. Nobody likes to be forced to do anything, especially if it's something that you're not very knowledgeable about, or, like I said, it's something that's brand new as a COVID-19 vaccination. So here, everybody has their right to get vaccinated or not. And, and we're blessed in order to, have that choice. And if you really feel like you don't want to be vaccinated and right now it's not required to travel, you need a COVID test to travel, and you just need to be negative for COVID to travel, negative for COVID to go to work, etc. So if you really don't feel comfortable with taking it, you don't have to take it. It's really up to you. But if you feel like you want to be protected from the coronavirus, or you want to protect your family and prevent the spread of it unknowingly to other people, then that's also up to you. So no one's forcing anyone to get the vaccine right now.
Okay.
That might change in the future. We don't know, but as of right now, it's not mandatory.
But I do believe too, some people are very reluctant to get it because we're not really learned on the vaccine.
Right.
We're not educated about it.
Right.
We just heard some stuff and we get scared. Oh, this can do that, this can do that. But if we can just go study it, understand what it is, it'll make you more
feel a little bit better about it. Yeah, and then as they, produce more and more, they tweak it a little bit. In the next coming years, I hear a lot of jokes of people saying, "Hey, they're not going to take the first wave. They take the second wave. Then everyone try it out first and see how it is, and then they'll take the second wave." So
that's it. If you grow that's how we think.
Yeah, definitely. Right. And that's perfectly fine.
Yeah.
So,
each his own.
So.
Wow. Okay. Is there any long-term side effects to after taking the shots?
We don't know yet because nobody has had the vaccination for a long time. Yeah. So you can't predict the effect that it'll have on you in the future because nobody has seen what it has done. I mean, COVID-19, it started at the end of 2019. It's a year old. Yeah. It's a year and a half old. It's something that's totally brand new, and the virus itself is mutating every day. And so we're just, at this point, we're trying to catch up to the virus itself, but we're not ahead of it by any means. So we're just trying to, get a hold of the situation, but definitely not ahead of it yet.
Okay. Do you think that workers can remove themselves from their workplace if they believe that they're not safe with COVID-19?
Yeah, by any means. I believe so. As a part of, being an employer myself, I have to take and even more so because I run a laboratory that deals and handles with COVID-19. If my, lab techs or my interns were to say, hey, I feel like this protocol or this procedure puts me at risk, that's my responsibility as an employer to make my employees feel safe. And that's the same thing goes with any job. I feel like as an employer, you have to make sure that your employees feel safe. Yes, and if as an employee you feel unsafe, then you have every right to, not work there. I mean, nobody's forcing you to work anywhere, right?
No.
If you don't feel safe someplace, you definitely shouldn't be there. So, Are there people? I don't know. Have there been complaints about workers about the safety of their workplace?
I haven't heard none recently. I haven't heard none. No.
Yeah. Okay. That's definitely something that I'm gonna watch out for and listen to because that's a very, very good question.
Yeah. Can the mask prevent the transmission of COVID-19?
Yes, of course. Do you know what's interesting is since the coronavirus, the instance of the flu has gone down 98%. Okay. And that's because the precautions that people are taking. People are washing their hands.
Yes.
People are, staying away from others. They're wearing masks. We're generally much, much cleaner now. As a population of people than before. But in the mask definitely, it plays a huge part in the prevention of COVID-19. So yeah, I definitely would still wear your mask, and if not wear your mask, definitely maintain social distance. You're not trying to get your saliva and your spit and everything. All of other people try not to be in everyone's face. That's how any disease, flu, anything. Yeah.
Well, you guys heard it. Even though we're tired of wearing the mask,
we're tired.
Sometimes it's very frustrating, especially when hot and everything.
Yes.
But it's safe.
It is. It's safe. It's safe. And if you don't want a mask, you have a shield.
Yeah. Yes.
I love this.
But even with those masks, they're saying you must also wear another mask underneath it.
Yeah, they do say that. But hey, I can't make the rules of another person's establishment. I can only follow the rules of another person's establishment. Me personally, someone wants to come into my clinic wearing a face shield and I'm totally fine with that. Yeah.
But they're still covering up and they're still keeping everything in.
Yeah.
Okay. So again, please, let's continue wear our masks. Let's continue social distance. And please wash and sanitize. Because we got to beat this. And we will beat this. With God help, we can beat it. We can beat it.
For sure.
We can beat it. Okay. What happens if I don't want to take if I don't want to take it or I feel like I shouldn't take it? the
The
COVID
vaccine?
vaccine?
As of right now, there's no penalties for not taking the vaccine. As far as I'm concerned, I might not be, fully up to date. But as far as I'm concerned, I don't think that anyone's going to be thrown into jail for not being vaccinated or anything like that. I would be surprised if that was the case, but I definitely do encourage everyone to go get their vaccines, to really, once we have a greater population of people being vaccinated, then we can kind of lift some more restrictions.
Yes, okay.
So that is what I think everyone is aiming for the restrictions to kind of be let up, which, they've been getting better and better. But when you have a larger population of people vaccinated, that's when you really see the slowdown and eventual halt of the spread of coronavirus. So definitely, although now there are no penalties for not being vaccinated, I would say that go get your vaccines. It's provided to you.
Okay. So there's no age limits to get, but everybody is free to, if all age are free to get it?
Now, I'm not 100% sure right now. I feel like the elderly can get it. Like teachers, medical employees.
Do you know why the USA haven't approved the vaccine that we're using earlier?
Well, the FDA is an entity that is responsible for the health of everyone in the United States, and so in order for it to approve a certain drug or a food, it has to go through a certain number of trials. So it has to be deemed safe on animals first, and then it has to be deemed safe on a group of people. They call it human trials, clinical trials. And it has to go through a certain amount of stages. I think that in the case of the AstraZeneca vaccination, it hasn't really had the opportunity to go through those stages in order to get that approval yet. As I'm saying, with a new vaccine, it's not, it hasn't had the time to go through all of the, every single stage, all of the clinical trials and the testing period required for it to get that FDA approval. So that is, I guess everyone's biggest and main concern. Does that mean that it's unsafe? I feel like we should wait and find out. I think that the Bahamas definitely needs a governing body to really determine whether certain drugs and food sold here in the Bahamas is safe for our public. That would be something that I would, currently we have the Ministry of Health, of course.
Yes.
But what protocols are in place in order to, what type of testing and what type of clinical trials do our, drugs and food and everything go to in order to be given to every human people? That's a good question. So that's something that is definitely should be thought about.
Who is more high risk when it comes to coronavirus?
Those people with any comorbidities, meaning people who are overweight, have any underlying diseases, obviously the elderly, people 60, 65 years old and older, people who have compromised immune system, very young children, those are all at-risk groups for COVID-19.
Okay. So what does it mean when we say flatten the COVID-19 curve?
Flatten the curve basically just means, slowing the spread of it and lowering the amount of people who are infected with it every day and lowering the amount of people who die from COVID every single day. So, essentially you have a chart. Everyone's been in school in math. You have x-axis and your y-axis. And as you have the incidence of COVID goes up, goes like that.
Wow.
Alright? And so what we're going to do is we're going to flatten the curve. We're going to have it at 0 as time goes on. And so that's, essentially means flatten the curve, lower the incidences of COVID, the spread of COVID, and ultimately the deaths resulting from COVID.
Well, I know we've said it before, and we got to keep on pushing out there for us to really flatten and really get this thing out the way. That's social distance, people. please, we
Yeah.
got to do that. We got to remember that. Let's wash our hands because I'm ready for this COVID to go now. I really am. I really am. And you know, we're going to get there. We're going to get there.
Yes, as am I. But I feel like slowly but surely people are really, getting used to, having better hygiene habits, social distancing, wearing their masks, and that's really what's going to ultimately help. Getting tested regularly, that's what's going to really help slow down the spread of coronavirus indefinitely.
As we wrap up, Ms. Evans, I do thank you for joining us tonight.
You're welcome.
It
You're
was
more than
very
welcome.
good, very informative, and we do appreciate you. Before we close, is there any last thing you'd like to say?
Just thank you for having me. I think what you guys are doing is absolutely great. I love it when people really take the initiative to educate the public. So you guys are really doing an excellent job. And I really appreciate you guys having me today and considering me and having me as a guest on your show. And keep up the good work. I think you're doing great. And COVID won't be around forever.
No, it won't.
But or maybe it will. Who knows?
We pray it won't.
We pray that it won't, though. We pray that it won't. That's it.
Okay. Thank you again so much.
You're more than welcome.
Thank you so much. Please join us again next week where our guest will be Chef Sean Newton and Sister Cleopatra White, where we'll be talking about Feed My Sheep. If you've come to on late or know somebody where to catch a rebroadcast, catch us at The Voice of Pilgrim, Nassau, Bahamas on Facebook, or on YouTube at The Voice of Pilgrim Baptist Temple. Thank you for joining in and see you next week, same time, same channel. God bless.
Thank you for listening to the program The Voice of Pilgrim, which was brought to you by Jonah Telecom Bahamas Limited, 376-8999. They install and maintain telecommunication towers from Bimini and Grand Bahama in the north to Inago in the south to ensure clear, continuous cellular service throughout the Bahamas. Easy Trucking at 357-4394. They specialize in flatbed and container deliveries and 20 to 40-foot chassis rentals. They make trucking easy with over 24 years of experience in the heavy hauling business. The Craft Shack, Wolf Road, opposite the Windsor Park, 829-7412, specializing in junk canoe and carnival supplies, balloons and party supplies, hats, fascinators, and jewelry making items. They supply the items, tools, and decorations for all your craft needs. ATC Financial Advisors and Consultants, with over 19 years experience in accounting and auditing, they offer reliable and professional service in internal audit, enterprise risk management, corporate governance, financial planning, and accounting. For more information, call them at 376-0411 or visit their website at www.atcadvisors.com. And also, the fine members of the Pilgrim Baptist Temple, tune in next week, same time, same station, where we will be happy to bring you another interesting broadcast of The Voice of Pilgrim. God bless you and have a wonderful evening.